Hello friends, welcome again to your own YouTube channel Ask Your Gynaecologist. I am Dr. Sonal Parihar. As usual, I have come up with a new video, a very small topic which has been requested again and again by you people. And the topic is low-lying placenta. Now before I start talking about this low-lying placenta, I would just say that the DocWise app is doing very well. Many patients have been connected with it, and daily almost 5 to 6 patients are asking me their questions. I'm chatting with them just like WhatsApp. They're sending their reports to me. I'm also calling them if they request that, ma'am, please call me. Then I have an option of calling them through the application. Okay, then you can always send me the voice messages. I'm also sending you voice messages. So it's a very good application. I'm really enjoying it, and I hope the patients who are actually downloading and connecting with me, they are also enjoying. So there is a lot of hope from this application. You can always download it from your Play Store, in the mobile Play Store. If you have any technical problem, this is the phone number of Shubham. He is the person who deals with this particular app, and you can always call him. Okay, if you want to come and visit me in my hospital, then this is my hospital's address, the landline number as well as my secretary's number. You can take an appointment. Now there are other platforms where you can follow me, like my pages, Facebook pages, Twitter and Instagram accounts, but please don't ask medical questions on these accounts because they are not meant to be medical platforms. They are just different things that I'm doing in my life, like probably a crown hunt training. I do personality development training, I do pageant training because I'm a title holder. So try and follow me there. If at all you have any query, please come on the YouTube. The reason I put all these channels is because some people are not very well versed with YouTube and they like commenting on Facebook and Instagram. So if you do comment, I will definitely reply, but I would try to bring you back to YouTube. Okay, so let's start with the topic low-lying placenta. Now low-lying placenta means the placenta is not at the right position. What is the right position of the placenta? Well, when you conceive, the uterus is normally 7 to 7.5 centimeters of size. So initially when you conceive, obviously the uterus is very small. So it will take time to grow and get divided into upper and lower segment. Okay, so initially when you get a scan done in the say 11-12 weeks, when you're just about 3 months pregnant, at that time you will see, as shown in the diagram in the photograph, that the entire uterus is full of placenta. That is because the chorion is developing, the placenta is developing. In the 5th month, when you have a sonography, again many patients will have a report saying low-lying placenta. That's because your uterus is still growing. In the 4th and 5th month, most of the uterus is covered with placenta still. Only some part is bare. That is because it is still growing and the uterus is still not divided into upper and lower segment. It is only in the later 3rd trimester when it starts getting divided, and that is the time when your placenta also grows with the uterus. So as the uterus grows, the fundus goes up. Similarly, the placenta also goes up with it. Okay, so the uterus gets divided into upper segment and lower segment, right? Now 99.5% patients who had a report of low-lying placenta in the 5th month will have a normal upper segment placenta in the 9th month. Now what are the 3 positions of placenta? It can be either anterior, on the anterior wall, it can be posterior, it can be fundal, or it can be a combination like fundo-anterior, fundo-posterior. These are the normal places where the placenta resides, where the placenta embeds in the uterine wall. But if it is low-lying, in the 0.5% cases where it does not move up, where it does not grow. Now we all know that the uterus comes from this size to this size till the end of 9th month. So that is just nature. We have nothing to do with it. God has made the structure like that. So the placenta has to move with it. If the placenta doesn't move, then it is termed as low-lying placenta or placenta previa. Now I was talking about the 0.5% patients in which this placenta doesn't move. Generally these patients have either had a surgery before, like a uterine surgery, any scar on the uterus, that is a place where it is weak and the placenta gets embedded there. Okay, or in other patients, sometimes they might have a lower segment cesarean section. Now we all know that when cesarean section is done, it is always the lower segment which is cut. It is not the upper segment, because it is easy to remove the baby, to get the head out or the legs out from the lower segment because it is thin. So whenever you have a cesarean section in the previous pregnancy, that particular area is weak, it is scarred, and that is where the placenta goes and resides. So these are some conditions, some patients who are high risk to have a low-lying placenta in their next pregnancy. Okay, now how common is low-lying placenta? Well, it is quite common. 1 out of 200 will have a report of low-lying placenta. Now it is more common when you actually see the 5th month, because in 5th month many patients will have a low-lying placenta. But I am talking about the incidence of patients in the 9th month. So in the 9th month again, out of 200, 1 will have a low-lying placenta, but not all will end up in a cesarean section. Okay, why? Well, because low-lying placenta can be of 3 types, or broadly speaking you can say it 4 types as well. Now grade 1 or type 1 is where the placenta has moved from the upper segment to the lower segment. So it is lying in the lower segment as well. Some part of it is in the lower segment as well. It has encroached the lower segment, right? So that is type 1. Generally, they don't have any symptoms. It is just an accidental finding. They may have a little bit of bleeding. Sometimes because the lower segment kind of goes under contractions and relaxation. Sometimes because when the baby moves, there might be some capillaries which burst. So little bit of bleeding, little bit of backache maybe. Otherwise, generally asymptomatic. Now, coming to the type 2, that is grade 2. That means the placenta has actually reached the mouth of the uterus, that is the cervix. So it is just near the mouth of the cervix, mouth of the uterus. Now, this marginal placenta previa or low-lying placenta definitely can cause bleeding, especially when you're starting to dilate. When the cervix is going to open during delivery, it might burst some capillaries of the placenta because it is lying just there, and that may lead you towards a complication, a high-risk patient. You might end up in a cesarean, but generally speaking, if the doctor does a parvaginal examination, internal examination, and the head or the presenting part has crossed that particular area of the placenta, then normal delivery is still possible. So it is kind of 50-50%. Okay, so that is type 2. Now type 3. Type 3 means it is actually covering the mouth of the cervix, that is the mouth of the uterus, the cervix. Now when it is covering, it can be of grade 3 or grade 4. So some books, they actually divide this type 3 into two parts, that it is partially covering the cervix, that half of the cervix is covered, or when it is completely covering the cervix, complete blockage of the place from where the hole from where the baby comes out. So that is type 4 and type 3. Now type 3 and type 4 both are very risky because it is actually covering the cervix. It is actually not letting your baby come out through the normal way, and in type 3 and type 4 obviously the cesarean has to be done. When? Depends upon what is the complication, what is the high risk, what symptoms you have, and what age what gestational age you are starting to bleed. So what all criteria the doctor has to decide, right? So type 3 and type 4, if you actually take it as marginally covering or completely covering the mouth of the uterus, then that is very risky. Now coming to the initial one, the type 1 and type 2, type 1 generally causes no problem. Type 2, 50% chances of normal delivery, 50% it depends upon doctor's expertise and your complications. Okay, now why does the placenta bleed? Well, placenta is full of blood vessels. Placenta is the connection between the mother and the baby. The capillaries, the veins and arteries, they all carry blood. They give nourishment to the baby, right? So when you start bleeding, now why do you start bleeding? Because whenever there is some movement in the uterus because of intercourse, because of baby's movement, because of dilatation, the capillaries of the placenta, they get separated, they get burst because the placenta gets separated. Little bit of separation can cause bleeding. And this bleeding will hamper the blood supply to the baby, and it is risky for you as well because that blood contains the fetal blood as well as your blood. So it is risky for the mother as well as the baby. Okay, now what can you do about it? Well, you cannot do anything about it because it is all nature. It is the nature which decides whether the placenta has to go down or has to move up. Okay, you just have to obey your doctor. What will the doctor advise you? Bed rest, obviously. Now the type of bed rest will depend upon again your complication, your high risk. Okay, some patients will even be hospitalized for 2-3 months if they are really high risk because the doctor wants your baby to stay inside the uterus till about 34-35 weeks because that is the time when we expect that the baby, if it comes out at say 34-35 weeks, that it will be mature enough and will be able to breathe. Okay, but there are cases in which we have to remove the baby at 24, even 27, 28 weeks. So we try and put you to bed rest so that you do not bleed and the baby and the mother are safe. Okay, then you will be given some injections for the lung maturity, betnesol injections for the baby's lung maturity if we are planning an early delivery. You will be advised not to have intercourse with your partner because that can cause bleeding. You will be advised not to put anything inside the vagina. Even the doctor will not examine you internally if it is a proven placenta previa. No instruments will be put in because we know that it might cause more bleeding. Okay, now it just depends what kind of placenta previa you have. Type 1 and type 2 we can easily do an examination, a gentle examination to assess whether the baby's head or the presenting part has come down and whether you can have a normal delivery or not. Okay, what else? You will be given some antibiotics if we suspect some infection. Okay, then obviously exercise is not advisable, no exercise at all, and that's it. And then the plan will be made for your delivery, whether normal or cesarean. Right? Now, the other question, the last question I would say, what patients ask me, what is the recurrence rate? Well, if you have any problem, have had any problem in your previous pregnancy, whether it was abortion, whether it was threatened miscarriage, whether it was diabetes, PIH, high blood pressure, or second trimester miscarriages, or even low-lying placenta, it always increases your risk to have the similar complication in the next pregnancy. So your risk is 2 to 3% higher as compared to a female who has never had a low-lying placenta. Okay, so I think this is all you need to know about this, guys. And if you have any more questions, you can always ask me. You can follow me on my all my platforms. This is my hospital's address. Again, DocWise app is doing wonders. Even patients from abroad, in like outside India, from Gulf countries, from European countries, they are consulting me. So I'm really happy the application is really doing well. And if you have any technical problem, then you can contact Shubham. Okay, so I'll be back again with the new video. Keep sharing, keep liking, keep subscribing so that you get a notification. Every day I go live and answer your questions, generally in the evening hours. So again, I'll be live again tomorrow. So please follow me and please like the videos. Please subscribe. Bye bye.